So before we come back to Clubfoot, tell my audience what other public health issues we have in Nigeria and Africa at the moment.
Yeah, there's a lot happening. Of course, we're conversant with COVID. COVID has not completely gone, even though it has been said, it has been declared not an emergency anymore, but it's still a public health issue. So COVID is there, malaria is there, HIV/AIDS, of course. We've made there's been a great success stories associated with HIV/AIDS, but just like it is still a public health concern. And there's this group of diseases called neglected tropical diseases, NTDs. I don't know if you've heard about them, such as schistosomiasis, onchocerciasis, and lymphatic filariasis. They are everywhere. And some of these are commoner in the riverine areas.
Okay.
Some people like farmers, like fish farmers, fishermen, they live there. That is what they do. That is the life they've known. So they are prone to some of these illnesses. I don't know if you've heard of kidney worm and all that. Some communities, some population in certain communities are more prone to these issues. And then, of course, that maternal and child health is of a public health concern. Nigeria has a very high maternal mortality rate and infant mortality too, and all other such related diseases. So these are the common ones I can quickly
mention.
think of.
Yeah.
Yes, and the government is trying their best. Their best may not be good enough, but they are trying their best. They are working in collaboration with many international NGOs and even local NGOs to strengthen our health system to be able to address these issues. You saw what happened with COVID. When COVID came, it was as if we were not ready in pandemic response. Everybody was doing guesswork. We'll borrow from Malawi. We hear that one country is doing this, so we'll say, okay, let's do it. Even the whole world as it were, even the so-called developed countries, everybody was confused. So public health interventions go a lot with collaborations, partnerships, health system strengthening, so that it's a concerted effort, it's a joint effort, all hands on deck. So that's what is happening right now. Like I said earlier, even though I'm working on Clubfoot, even though my colleague may be working on malaria program, even though someone else might be in HIV program, once in a while there are some fora that bring everybody together, right? Where we have stakeholder meetings. Sometimes you network and see what you can learn from each other. So it's really been an interesting journey. And I have no regrets whatsoever.
Very good. Very good.